Welcome to the Equine Anatomy lectures. My name is Ayman Saig, and I teach Equine Anatomy at Tuskegee University College of Veterinary Medicine. In the following lectures, what I will do is I'll talk about the anatomy of the head, and after that, the anatomy of the neck. After that, we'll talk about the anatomy of the thorax, and then the anatomy of the abdominal cavity of the equine patient. Um, Followed by the male and female reproductive systems. Then we'll talk about the hind limb, and then the forelimb as the end of the course. Now, what I will do here is I'll talk about the things that are um, the structures that are clinically relevant. I'm not going to be talking about detailed basic anatomy because I assume that you guys had the basic anatomy in the first semester. Now, um, also, I would like to mention that if you have any questions or comments, uh, please send me an email at aymansaig@hotmail.com. My first and last name without spaces at hotmail.com, and I'll be more than happy to to respond and explain things if needed. Now, as I always do in my lectures, whether they were gastrointestinal physiology or anatomy or any kind of lecture, what I will do is first I'd like to start by stating the significance of the topic. Why should I study this topic? First, I would like to convince you, if you will, that studying the topic is important, and then after that we'll talk about very basic structures. So some of the bones on the skull, some of the external features, some of the nerve blocks, on the face and around the eye. After that, we'll talk about special structures in the equine head, such as the nasal cavity, the sinuses, the guttural pouches, larynx, soft palate, and epiglottis. Um, so let's start by talking about the significance of this topic. I'm going to show you a number of clinical cases to demonstrate basically how important studying the anatomy of the equine head is for you. This slide clearly shows that there was a laceration in the upper eyelid in a horse, and in the picture to your right, after the healing process, after the treatment. So we need to understand how we can block certain areas around the eye, basically, in order for us to be able to treat this patient and have this beautiful outcome in picture B. This is another picture showing a severe burn in the equine face. 3 stages basically. Um, all the way to the right, you have almost the lesion almost healed. In the first one, it's severe burn. In the middle one, there's some connective tissue building up, and the healing process is going well. So basically, also here we need to understand what type of nerve blocks we have to use in the face in order for us to be able to treat such cases. In addition to the lesions that the horse encounters, also there's very important structures that lay underneath the skin immediately. They're very superficial. We have to be aware of those in order for us to see if there are some malfunction of these nerves due to direct trauma. Uh, in the picture on the right hand side, you will see that there's a very big lesion that's blocking the whole nostril, and knowing the anatomy of the equine head will allow us basically to understand, when we take this surgically, what structures is basically this lesion is covering, and not to injure those structures. Let's see the superficial nerves of in the whole horse's face and see how important they are in the clinical practice. The two pictures here show two cranial nerves that are located pretty superficially, meaning just under the skin, the facial nerve and the trigeminal nerve. These nerves, I mentioned earlier that any direct trauma to the face or to the head may injure such nerves, and of course we're gonna see lesions like this lesion. This is facial nerve paralysis, basically, and you can see deviation of the mouth, the lip toward the left-hand side in the left-hand side picture A, and you can see how the horse is basically affected by trauma to the facial nerve. The picture to the right basically shows some technique, electroacupuncture, to treat certain cases of the um, injuries to the facial nerve. But this is basically this and the other clinical cases that I showed earlier demonstrate to you how important studying the equine anatomy of the head is from a clinical standpoint. So if we establish this point, then next I would like to talk to you about very basic and very simple structures in the skull, and after that in the structures of the head. So let's start about what kind of bones basically form the equine head. I will talk about three different views. Just the name of the bones, and you had them in small animal anatomy, so I'm not gonna dwell on them. Just gonna mention them so you can actually remember what we're talking about when we talk about lesions and things like that. So we'll talk about a dorsal view, a lateral view, and a ventral view. This picture shows a dorsal view of the equine skull. Number one is the incisive bone, where the incisors are, the teeth. Number two is the nasal bone. For example, three is the maxillary bone. And number six is the frontal bone. We will talk about the sinuses later. Number five is lacrimal bone. And eight is parietal bone. And 10 is occipital bone. We will talk about the atlanto-occipital area later on. So these are some of the bones that form the skull: incisive, nasal, maxillary, frontal, lacrimal, occipital, things like that. And you know the basics from before, as I mentioned before. This picture shows a lateral view of the equine skull. Again, incisive bone is number one, two is nasal, three is maxillary, and then 12 is occipital. Uh, the lacrimal is number four. We'll talk about it when we discuss the nerve blocks around the eye and things like that. So these are the basic, a number of basic bones that I would like for you to remember: nasal, incisive, maxillary, lacrimal, frontal, and occipital. Four or five of them will be enough. This is a ventral view of the equine skull, and here I would like you to remember number four, which is the vomer bone. The vomer bone is where the nasal septum sits, basically, or resides, and this important bone is required when we fix nasal septum deviation, or deviation of the nasal septum in equine. Okay, so we've talked about the number of bones that we have in the equine skull. Let's see what kind of superficial features we will have there too. I would like you to remember three external features on the equine skull: the naso-incisive notch, the facial crest, and the mandibular notch. Naso-incisive notch, facial crest, and mandibular notch. Three external features. Now we have three foramens: supraorbital foramen, infraorbital foramen, and mental foramen. So we have three external features, and we have three foramens. The features are naso-incisive notch, facial crest, and mandibular notch. The foramens are supraorbital, above the eye, above the orbit of the eye, infraorbital, below the orbit of the eye, and mental foramen. There's also a fourth foramen, we call it a mandibular foramen, which is from the medial aspect of the mandible. Here, there's a nerve that will come from this foramen that sometimes we need to block. And so, with the three foramens, we have three nerve blocks that will go with them. We have infraorbital nerve block, we have mental nerve block, and we have mandibular nerve block. So three nerve blocks: infraorbital, mental, mandibular. Each one of them corresponds with one of the foramens that we mentioned earlier. Now here you might wonder and say, okay, well, we still have the supraorbital foramen, and I would agree with you, but we'll do that with the eye nerve blocks, or with the nerve blocks of the eye. So now I divided the nerve blocks into two regions: the face in general and the eye. The face, we have infraorbital, mental, and mandibular. The eye, on the other hand, we have five nerve blocks that we need to understand and remember, because these nerve blocks are very important, not only to suture lacerations and remove lesions, but also to examine the eye. These nerve blocks are extremely, extremely important. These nerve blocks for the eye are supraorbital, auriculopalpebral, lacrimal, zygomaticofacial, and infratrochlear. We will talk about them in detail with landmarks and what nerves you will be blocking and things like that pretty soon. But for now, we divided the nerve blocks in the equine head into two parts. One that blocks the areas of the face, and these are three nerve blocks: infraorbital, mental, and mandibular. On the other hand, you have five nerve blocks around the eye, five nerve blocks around the eye to remove lesions, to suture lacerations, to examine the eye. All of this are basically required when you do these nerve blocks: supraorbital, auriculopalpebral, lacrimal, zygomaticofacial, and infratrochlear. Now, all of the nerve blocks of the face, the infraorbital, the mental, and the mandibular, are basically coming from the trigeminal nerve, the trigeminal nerve that I just talked about earlier. And all of these nerve blocks correspond with the name of the nerve, which is a branch of the trigeminal. The name of the branch of the trigeminal that's coming from the foramen that we've talked about. So the infraorbital nerve comes in the infraorbital foramen. The mental nerve comes from the mental foramen. Mandibular alveolar comes from the mandibular foramen. And all of these nerves, infraorbital nerve, mental nerve, mandibular alveolar nerve, are coming or branches of the trigeminal nerve, the trigeminal nerve. You've seen this picture before, and this shows you these branches that we've talked about and how they come off the trigeminal nerve. The fifth cranial nerve gives mandibular nerve that goes through the mandibular foramen, mental nerve that goes through the mental foramen, and infraorbital nerve that goes through the infraorbital foramen. This picture shows where the three locations of the three nerve blocks of the face are. The infraorbital, the mandibular, and the mental. Now what I will do is I'm going to talk about each of these points, basically in details. What's the landmark to inject, and what are the structures that will be desensitized by each of the nerve blocks. So we'll start with number 1. So the very first nerve block is the infraorbital nerve block. And in order for us to localize the infraorbital foramen, we use what we call the three-finger method. Basically what we do is we put the index at the end of the facial crest. We put the middle finger at the naso-incisive notch, and the free finger will basically fall directly on the infraorbital foramen. In order for us to palpate this foramen, we have to elevate the levator labii superioris muscle. We have to take it out of the way, basically. And when we do this nerve block, we desensitize the upper lip, the nostrils, the first upper two cheek teeth. Let's take a look at how this is done. So this picture basically shows the technique for doing the infraorbital nerve block, and what the veterinarian is doing basically is with his or her thumb, they're removing the muscle, which is the levator labii superioris muscle, out of the way, so they can inject the anesthesia in the infraorbital foramen. Now again, this will desensitize the upper lip, the nose, and the first upper two cheek teeth. If you know anything that happened in these areas, then this nerve block will be sufficient enough to fix them, basically. Just like in this picture, for example, this is external laceration in the nostrils, and it's shown on the left hand side where the laceration is in the nostril, and in the right hand picture it shows after suturing. Of course, the surgeon or the veterinarian basically utilize the infraorbital nerve block for this lesion. The second nerve block is the mental nerve block. The mental nerve block is we have to palpate the mental foramen, which is very easy to do, and it's about an inch or two. You can palpate it, caudal to the canine teeth. So behind the canine, you can palpate the foramen, and there the foramen is also covered by the depressor labii inferioris muscle. The depressor labii inferioris muscle. So you have to remove the muscle out of the way with your thumb and inject your anesthetic solution in that area, again in the foramen. Now this desensitizes the lower lip and the canine and incisors too. So any problem with the lower lip, laceration or anything, or extraction of the canine of the incisors in the lower incisors, basically you can utilize the mental nerve block. This picture will show you a case that can be done with the mental nerve block. This is basically, a case that requires tooth extraction, and it's shown here how the tooth is broken, and a mental nerve block is sufficient to remove the broken teeth and excise it out of the way. The third nerve block is the mandibular alveolar nerve block. This is the mandibular alveolar nerve block. Um, this nerve block is a little tricky because it's located in the medial aspect of the mandible. So it's not toward the outside. It's actually toward the inside of the mandible. And the way you basically localize this mandibular foramen is to basically by doing um, a an intersection point, basically, like the slide shown here. This is the slide just shows where the point for injecting in the mandibular foramen is located. So you basically draw two lines, and where these two lines are intersected, this is the point where you need to inject. And these lines are basically the masticatory surface of the cheek teeth, the first line, and then the other one is caudal to the lateral canthus of the eye, the lateral canthus of the eye. The intersection point between these two lines is basically where you need to inject from the medial aspect. So it's an intersection point between a line parallel to the masticatory surface of the cheek teeth, or the cheek teeth, and the lateral canthus This yellow dot, this yellow circle, basically shows where the mandibular foramen is located. So what you do basically is you measure on you do these two lines on the lateral surface of the face. So something you can see basically. You put your finger where this intersection point is, and you measure the size of the length of the needle that you need to inject with. And then you go from the medial side and you basically inject at that point that you basically measured on the lateral side. But you don't inject on the lateral side. You inject on the medial side because the foramen is on the medial side. But drawing the lines, you draw them on the lateral side, or the lateral surface of the face. Okay, so now this nerve block will basically desensitize the lower cheek teeth, and it's used for such purposes. Um, so these are the three nerve blocks for the face. the infraorbital, mental, and mandibular alveolar nerve blocks. Again, these are the nerves that branches of the trigeminal nerve, the infraorbital, mental, and mandibular alveolar. These are all branches of the or from the trigeminal nerve, the fifth cranial nerve. Now we finish the nerves of or the nerve blocks of the face. Now we move toward the nerve blocks of the eye. So the nerve blocks of the eye are pretty important. These nerve blocks are important for many reasons. The very first thing is to do a complete ophthalmic exam. Complete ophthalmic exam requires nerve blocks around the eye so the examiner can actually see what's going on in the eye. Another thing is to diagnose diseases. In the left-hand side picture, you have ocular edema. You can see there's a lot of swelling in the upper eyelid. And on the right-hand side picture, you can see ultrasound probe to basically show if there is any swelling in that eye or not. And so for this, the horse will not stand still for you to do all of these exams. It has to be desensitized around these areas so the horse can basically feel safe that nothing bad is going to happen to him, and also you will feel comfortable to do a complete and more meaningful exam. You've seen this picture earlier, lacerations of the eye, on the left-hand side picture, and on the right-hand side picture, that's after the treatment, basically. And of course, you need to know how to do nerve blocks around the eye, so you can suture and fix these lacerations. So this is a very important thing for the eye. Another thing is corneal ulcers. Corneal ulcers is a very common disease in equine, and which requires basically detailed clinical examination of the eye. And of course, without nerve blocks, it's not going to be able to be possible. Not only this, but also the treatment of eye diseases in horses require putting an injection system that's called a subpalpebral lavage system, such as the one shown here. The subpalpebral lavage system is basically a plastic tube that has holes in it, and we put it toward the inside of the eye, and we keep the other end of it toward the outside. As you can see here, it's braided with the horse, so you can actually inject the medication from the outside. And when you inject it from the outside, because the inside the other end of the tube is basically, which is inside the eye, is has holes in it, has pores in it. That's where the medication gets into the eye. These systems are very important because doing ophthalmic treatments in equine requires a lot of time and a lot of effort, and horses are pretty sensitive around the head area, so they don't like to be touched there a lot. So that's why we place the subpalpebral lavage system, and then we start injecting from the other end of the tube. And in order for us to implant this system into the infected eye, we have to know how to block the eyelid, so we can actually insert that tube inside the eyelid so it can go toward the eye. You can see the next picture here, how you inject from the outside. Again, because treating the eye requires a lot of injections. Sometimes you have to do it 5 times a day, and sometimes you have to do it 7 times a day. And the horse will not tolerate that you're doing, you're touching uh, its face 5 times or 3 times a day or 7 times a day. They get annoyed pretty easily, and so this system is very important to be utilized in these cases. And in order to put it, we have to, of course, to make sure that um, we have to know the eye blocks or the nerve blocks around the eye, so we can insert this into the eye. So this basically demonstrates to you how important the eye blocks, if you will, or the nerve blocks around the eye are from a clinical standpoint. And so what are these nerve blocks? These are the 5 nerve blocks around the eye: supraorbital nerve block, auriculopalpebral nerve block, lacrimal nerve block, zygomaticofacial nerve block, and infratrochlear nerve block. Again, supraorbital, auriculopalpebral, lacrimal, zygomaticofacial, and infratrochlear. In the next lecture, I will discuss in details each of these nerve blocks and why it's being utilized.